lot of the times the legislator coming in has other priorities on their mind in terms of finances. Where's the money coming from? So emphasizing not only the positive patient outcomes that these bills would promote, it would also help to emphasize how these fixes, while also common sense, are also of minimal to no cost to the state, making it even more, making even stronger of an argument to pass the bills. So. House Bill 5131 is a transition of care bill. Currently, there are a number of problems that patients face when they get prescriptions written at hospitals, because they'll go to a hospital for medical care, and it'll be indicated that they need a certain prescription drug, and the prescription will be written there. But when they leave the hospital, if they're going back home to a local community pharmacy, or a long-term care facility, they will not be allowed to have that prescription filled at these institutions, because once a prescription written in a hospital leaves the hospital building, it becomes invalid. So they face the problem of having to go back to the hospital to get the prescription rewritten, because they don't have, or they have to go back to the hospital for medical care because they don't have access to these prescription drugs that they need. So what 5131 does is allows a prescription written at a hospital to be transitioned to another institution where they can have that prescription filled. It's really just about patient care, making it more convenient and increasing health outcomes, or improving health outcomes for these patients who have to transition back and forth between different healthcare institutions. It's an issue because it is a great cost to the hospitals who have to readmit the patients and the patients themselves in terms of costs, physical and otherwise. And it is a real easy fix because it comes at no cost to the state, and it's just a simple allowing, loosening of the restrictions placed on where prescriptions can be filled. So it would be a great boon for the state and the patients of the state. In addition to ensuring the accuracy of the transition of care prescription, the bill would also recognize the role of the agent of the prescriber, the original prescriber who writes the role, as well as it would clarify who is allowed to sign the prescriptions in terms of who writes it originally and what's the signature, what that signature stands for and allows for with regards to where the prescription can be filled.
Okay. Is there any opposition to the legislation?
There is no opposition to the legislation. It passed out of the Senate Health Policy Committee unanimously, and it's about to be taken up on the Senate floor, where it will not face that much opposition, if any.